This cleansing product, BP 10:1 Cleanser, is used to treat acne and other skin conditions such as seborrheic dermatitis and rosacea. It contains an antibacterial agent and a drying agent which helps promote shedding of the top layer of skin, a process called keratolysis. It is recommended to use this product as directed by your healthcare professional. The usual dosage is to apply a thin layer to the affected area once or twice daily, or as directed by your doctor. It is best to use this product at the same time each day to help you remember. Make sure to wash and dry the affected area before applying. When using BP 10:1 Cleanser, it's important to remember that this medication is only for use on the skin. Before applying the cleanser, make sure to clean off any makeup, oil, and excess dirt from your face with a gentle cleanser. If using the liquid form, shake the bottle well before each use. If using the liquid cleanser, apply a generous layer of medication as directed by your doctor, usually once or twice daily. Gently massage it into the affected skin for 10 to 20 seconds until a full lather forms, then rinse thoroughly and pat dry. If using the cleansing cloth, wash the affected areas with a cleansing cloth as directed by your doctor, usually once or twice daily. First, wet your face with water, then wet the cloth and work into a full lather. Cleanse your face with the cloth for 10 to 20 seconds, avoiding getting the lather into your eyes. Rinse thoroughly and pat dry. If excessive drying occurs, you may need to rinse the cleanser off sooner or use it less often. It's important to avoid getting any of this medication in the eyes, on the lips, or inside the nose or mouth. If your condition does not improve or worsens, be sure to consult your doctor. It's important to be aware of potential side effects when using BP 10:1 Cleanser. Some common side effects may include redness, irritation, or scaling of the skin. If these effects persist or worsen, it's important to consult your doctor. This medication is prescribed because the benefits outweigh the risks for most people. However, some serious side effects may occur, such as cracked skin, weakness or fatigue, dark urine, yellowing of the eyes or skin, signs of infection, easy bruising or bleeding, and aching or swollen joints. It's important to notify your doctor immediately if you experience any of these serious side effects. If the medication is used on raw or broken skin, there may be an increased risk of side effects. It's important to consult your doctor for more information in this case. While it is rare, a serious allergic reaction to this medication can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using BP 10:1 Cleanser, it's important to let your doctor or pharmacist know if you are allergic to sulfacetamide, sulfur, or any other sulfa-containing products. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to discuss any allergies with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease. If you are planning to have surgery, make sure to let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, BP 10:1 Cleanser should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. Additionally, it's important to consult your doctor before using this medication if you are breastfeeding, as it may pass into breast milk. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Before making any changes to your medication dosage, always consult with your doctor. One product that may interact with BP 10:1 Cleanser is skin products containing silver, such as silver sulfadiazine. Be sure to discuss this with your doctor before using BP 10:1 Cleanser if you are using any skin products containing silver. If someone has taken too much BP 10-to-1 cleanser and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to remember that this medication can be harmful if swallowed. Always keep it out of reach of children and pets. Do not give this medication to anyone else. This medication is prescribed for your specific condition and should not be used by anyone else. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. Make sure to store BP 10-to-1 cleanser at room temperature and keep it out of reach of children and pets. Do not dispose of it by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.